Hi guys, welcome back to my channel. And in this video, I will be discussing external carotid artery and especially the facial artery and the MCQ regarding this topic. So let us begin. Now let us talk about the origin of the external carotid artery. So first of all, it is a major artery of the head and neck, and it supplies almost all the structures in the head and neck, and it is one of the main branches of the common carotid artery. Okay, the one being the external and the other being the internal carotid artery. Okay, and the origin of this common carotid artery is from the aorta. Okay, and yeah, and this common carotid artery divides into these two arteries, internal as well as the external carotid artery, at the level of the upper border of the thyroid cartilage in the neck. Okay. Now let us talk about the branches of this external carotid artery. So it supplies blood to the superficial structures of the head and neck, including the face, scalp, and the neck muscles. Okay. It gives rise to several branches that provide blood to different regions of the head and neck. So now let us discuss the branches of this external carotid artery. So we have got in total 8 branches. First is the first branch is divided into the anterior branch. Okay, anterior branch, then only middle branch, and then the posterior branch, and then the terminal branch. Okay, so we have got 4 branches of this external carotid artery. Okay, so first anterior branch, we have 3 arteries: superior thyroid artery, lingual artery, and the facial artery. Okay, we are going to discuss only the facial artery in this lecture. Okay, so yeah, so these are 3 arteries, which are the branch of the anterior branch of the external carotid artery. Okay, now only middle branch. So so the only middle branch of the of this external of this artery is the ascending pharyngeal artery. Now coming to the posterior branch, so we have got only 2 arteries: occipital artery and the posterior auricular artery. And the terminal branch, we have got maxillary artery and the superficial temporal artery, of which only the maxillary artery is the largest branch. Okay. Now you can see that the distribution of the branches of the external carotid artery. This is superior thyroid artery. This is the lingual artery. This is the facial artery. This is the maxillary artery. Superficial temporal artery. This is the posterior auricular artery. This is the, yeah, carotid triangle. This is the ascending pharyngeal artery. Okay. Now comes a very important part of this lecture. So, facial artery. Of course, the facial artery arises from the external carotid near the angle of the mandible, runs along the posterior edge of the lower jaw, and curves over the outside of the jaw and across the cheek of to to the mouth angle of the mouth. Okay, so we have got 8 branches of this facial artery. So first, we have got the cervical arteries, cervical branches, and then we have got the facial branches. Okay, so you can also come to this diagram showing the cervical part here and the facial part here. Okay, so cervical part, we have 4 branches: ascending palatine arteries, tonsillar branch, submental artery, and the glandular branches. Okay, these are the 4 arteries coming from the cervical region of the facial artery. Okay, yeah, I am marking it in black. These all are the cervical branches of the facial artery. Okay, and now facial branch of the facial artery. So we have got four branches of the facial artery, facial branch of the facial artery: inferior labial artery, superior labial artery, lateral nasal artery, and the angular artery. Okay, so you can see in this diagram, this is the angular artery, this is the lateral nasal artery, superior labial artery, and the inferior labial artery. Okay, and one of the important point to remember is the dorsal nasal artery, which is again the branch of the angular artery, is anastomosing with the ophthalmic artery, which is a branch of the internal carotid artery. Okay, so this point you should remember. Okay, dorsal nasal artery, which is a branch of the branch of the facial artery. It anastomoses with the ophthalmic artery, which is which is a branch of the internal carotid artery. Okay, so I'm giving you a question. Please answer this. It is very simple. All of the following statements are true regarding facial artery except. So pause, and I know that you know the answer. So guys, tell me the answer. Please, please. Is it a branch of external carotid artery? Its pulsation can be felt at the posterior inferior. Remember, guys, its pulsation can be felt at the anterior inferior, not posterior inferior. So, guys, our answer will be second option. Now, let us review the third option also. It has a tortuous course. Yes, it do has a tortuous course, and its tonsillar branch is the main supplier to our tonsils. Yes, it is true. It has tonsillar branch and it supplies the tonsils. So our answer is second option. Okay. So yeah, that's for today, and सब्सक्राइब कर जल्दी, ठीक है ना? ओके, सब्सक्राइब कर जल्दी.